South Africa has been battling an increase of malaria, cholera and measles cases. Not too long ago, at least 50 lives were lost to cholera, mostly in the Hammanskraal area. Most parts of the country have already reported measles outbreaks. Joining us to tell us what drives some of these diseases is Eugenio Langa, the Deputy Medical Director at International SOS. Dr. Langa, very good evening. Appreciate your time. So let's start off with the main diseases that African countries are struggling to deal with at the moment.
Thank you, Hugo. Good evening, and thank you for the invitation. It's great to be with you today and to discuss of these very concerning infectious disease outbreaks that we are experiencing in Africa. We have indeed been witnessing recently a massive upsurge of measles, malaria, and cholera in various countries across Africa. And this is due to various reasons, which include climate changes, people moving to urban areas, which definitely change the situation and how this disease has been behaving recently. So it's really important that we maintain ourselves attentive and be prepared to deal with these conditions.
Now, I'm particularly interested in how climate change impacts the spread of these diseases. Walk us through that, if you will.
For sure, Hugo. I think climate change is definitely a big one. Warmer temperatures, we've been seeing massive changes across all Africa. One of the major examples is the cyclones that have been affecting East Africa. For example, Mozambique have experienced recently the Freddy cyclone, which definitely impacts the overall sanitation of the country, which is already quite challenging. So definitely climate change affects the way the rain seasons and the flooding of these countries pattern they have experienced in the previous years. And with that, the current hygiene and sanitation becomes even more challenging for governments to really making sure that they can still keep control of these situations. With that, populations move from one places to others, which definitely affect the way diseases are transmitted.
Now, one of the diseases that is causing problems across the continent, or certainly in a number of countries, is cholera. And we reported earlier that South Africa had 50 deaths. How do we contain diseases like cholera in particular?
Yeah. Well, cholera can be quite challenging, and the major issue is that the onset of symptoms can be quite quickly and can progress quite quickly with diarrhea and vomiting and people becoming very dehydrated, which can culminate in immediate death. So it's really important that prevention is always the first step, making sure that for basic steps like washing the hands, sanitation of the environment, making sure you take care of your food before it's prepared to make sure that you don't carry the virus of cholera. Of course, for people traveling to areas where we know that there are ongoing outbreaks and that are endemic with cholera, it's really important to seek and have access to the vaccination for cholera to ensure even if you get the disease, it's not in a complicated manner.
Now, one of the biggest killers on the continent is malaria. You know, it has wreaked havoc across the continent. How do we deal with malaria?
Yeah. Definitely, Hugo, and it's quite interesting that even in the 21st century, we still talking about malaria as a killer disease, because we should be able to immediately diagnose and treat malaria to prevent such amount of deaths. International SOS follows a very good approach that is provided by WHO, which is the ABCDE. A is starting for awareness, making sure that we educate people on the signs and symptoms for them to be able to reach out for early diagnosis. B, which stands for bite prevention, making sure you wear long pants, you use your mosquito nets, making sure that the environment is free of mosquitoes. The C is for chemoprophylaxis, most importantly for people that are non-immune and traveling to endemic areas, making sure that they take some kind of medication to prevent getting malaria. The D, which stands for diagnosis, when you have the symptoms and signs, making sure that you reach out to healthcare facilities for early diagnosis. And the E, which is the emergency treatment, when you're traveling to endemic areas, making sure that you have access to the right treatment for malaria. But definitely this is still a major challenge. And again, with the climate changes and the cyclones and the floodings, we see more and more cases of malaria nowadays, even in months that are not usually the months where we see high cases of malaria.
Now, when we talk about prevention or targets around malaria, eradication comes to mind. Is that something that's on the horizon, or are we still very, very far from completely eradicating, maybe not malaria, but certainly deaths as a result of malaria?
Yeah, definitely eradication of malaria has always been the major target from WHO across the world, and specifically in Africa. But this is definitely still a major challenge. With the COVID pandemic recently, we have seen a shift on the focus from a public health perspective to ensure we could implement appropriate measures to prevent further deaths with COVID-19. But definitely now is the time to refocus on things like malaria and making sure that at least the complicated cases and deaths can be prevented accordingly.
Now let's turn our attention to measles and certainly the implications of COVID-19. What has that done to the eradication of measles, certainly dealing with measles? It's obviously vaccination driven. Just how much vaccination has or has not been done as a result of COVID, and certainly post that period?
Yeah, that's right, Hugo. So basically, as we know, COVID-19 definitely impacted the number of people reaching out to the healthcare facilities and therefore having access to vaccines. And with that, we talk about, for example, measles. Children could not get their shots as per their normal calendar or schedule for the vaccinations. So certainly COVID-19 has impacted the way healthcare facilities or policies could be implemented and the way that people could access to these vaccinations to ensure proper prevention.
Now, just how much at risk are children that are not vaccinated against measles, for instance?
Well, the risk is quite high, mostly for children that have never had the contact with measles. So in a situation of an outbreak of measles, these children that have not been vaccinated will be definitely prone to get the disease and most certainly getting the complicated forms of the disease. So it's really important that children that were not vaccinated during this period of COVID-19 pandemic are immediately vaccinated to ensure that they are well protected.
Now, we've talked about the proliferation of disease across the African continent. We've also touched on the Horn of Africa, which has faced numerous droughts in the last few years, and also war in certain parts of those countries. What are the implications of these factors on vaccination and prevention of disease? Obviously, when it comes to countries like Somalia, for instance, that are battling war, are they likely to move resources away from vaccination and so on, and move it to what might be deemed more important, like just allowing people to survive, giving them food and so on?
Mm-hmm. Well, Hugo, I think you touched a very good point, and thank you for that. The fact is that humanitarian crisis across Africa, we see in many countries like Somalia and Mali, as you mentioned rightly, affect the way governments are able to reach out to population to provide them with the correct preventive measures, namely vaccines. So it's really important that governments and at the end of the day also businesses can cooperate multi-sectorally to ensure all departments and ministries can be involved in reaching out to population and making sure that they can get access to this kind of preventive measures and ensure that the population is vaccinated. This is really crucial.
Dr. Langa, I appreciate your time. Dr. Eugenio Langa, Deputy Medical Director at International SOS, speaking to us from Luanda in Angola.